And Abhay Vasudha was telling me, what is there in Stellaris? Because he was telling me my son-in-law is mad after Stellaris. Now, Vishali tells her husband, I want you to do only 2.2 millimeter Alcon because she is a genetic Alcon ophthalmologist. Whereas somebody says, no, I want to do only 1.8 Bosch. So Vishali is actually having the Ozil technology between her father and husband, Ozil. But I found Samaresh in his operation theatre on a Stellaris machine which he likes very much. So what is this 1.8 millimeter we are all talking about? Look at these videos. You will come into a conclusion right away. I don't have to argue in a debate. Hard cataracts, brown cataracts, black cataracts. You can see how this technology works wonderfully well. Small pupils, patient on Urimax. Half my patients are on Urimax, half my patients are on Viagra. So you can see how the pupil is so floppy. But I don't use a iris retractor. I don't use any iris hooks. Nothing. All with the 1.8. Again, a brown or black cataract. See the excellent stability of the anterior chamber despite the fact I am using very high vacuum. Imagine 600 millimeters on a dual linear in Stellaris. If anybody says this is a cataract, I'll give them some money because it's like a granite inside the eye. You can see it. Such cataracts, on the left you see MICS Stellaris 1.8, crystal clear corneas. On the right, MICP. Because the Alcons, when they came into this technology, they said only 2.2 millimeter I can do. They didn't want to borrow the name from Stellaris or Bosch and Lomb. They said we will name it differently because Alcon is always very different. They said micro-incisional coaxial phacoemulsification. That's called MICP. This is a MICP patient after a brown cataract. And this patient, I called him Hypersol Kandaswamy because he had 65 bottles of Hypersol post-operatively. When he came once to for the post-operative clinic, the entire box he was carrying, 65 bottles, he wanted me to pay for all of them, and I asked Alcon to pay it. Post-operatively, you can see the wound in MSCS. These are not very soft cataracts, they are all very hard cataracts, pristine. The wound stability, you can see that in an Alcon, MICP, wound burn. You know the consequences of a corneal burn. Preoperative endothelial counts, specular endothelial, the infused astigmatism, which works very well. You can see the comparison between, I just take half a minute more. And you can see the comparison between the two, 1.8 on the left and the 2.2. And similar hard cataracts, but how the stability and the speed in which the whole surgery occurs. And Samaresh is on his horse back. And he says, the horse's mouth says, 1.8 millimeter S-mix is the best. And he also says, where the 2.2 millimeter, you know where it belongs. Take home message, Stellaris, safety, stability, small incision and supervision. And that is what is easy, effective, enjoyable for both the surgeon as well as the patient. Thank you very much. Thank you very much, Madi and the judges.
Dr. Mohan, please be there. Summary.